Live from the Jersey Shore to the world. Get up, get out, do something. Wake up with Jeremy Grunin. Take the show wherever you go. Download the free Radio Pup app for your smartphone or tablet. Join the conversation. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Hey, welcome back. Wake up with Jeremy Grunin. It is 7:07, Wednesday, May 25th. 56 degrees, get up to 86 today. WOBM AM 1160 and 1310 News Talk Radio. Streaming live on the Radio Pup app and WOBMAM.com, 732-505-1160. We are joined now in studio by Dr. Jagjeet Singh. We call you Vic, though, right? That's okay?
Yeah, that's fine.
All right, cool. And you are a pain management specialist at Ocean Medical Center. Right?
That's right, yeah.
That's good. So why don't you tell us a little about yourself and a little about your area of expertise?
Sure. My name is Dr. Vic Singh. I'm a board-certified interventional pain management physician and anesthesiologist, double board-certified. Myself and my colleagues at Ocean Medical Center provide the anesthesia and pain management services for the Meridian Hospital in Brick. We specialize in perioperative services as well as acute and chronic pain management, both in and outpatient.
Okay. So how did you decide, like when you're in medical school and you're like, I gotta really kind of lock down what I'm going to specialize in, and I know that you probably thought at first, I don't know, maybe I could be a colorectal guy, and then you're like, nah, maybe I'll pass on that, and you said, hey, let's do pain management. How'd you come up with that?
Yeah, that's a great question. Honestly, going into med school, you don't know what you're interested in. I mean, let me rephrase that. I didn't know what I was interested in.
Right.
And you go in there with an open mind, and as you go through your schooling and your rotation and so forth, you find what interests you. And so I found initially, very interested in anesthesiology, and then subsequently I did rotations in pain management. It was kind of a perfect fit for me. I felt like it was a great combination of both outpatient care as well as procedures that we can do to help patients get rid of chronic pain.
Right. Because at the end, for you, you're one of the few specialties where everybody leaves happy.
I wish that were true. But we try to take the best care that we can of our patients, of course. Yeah.
I know. Okay.
Absolutely.
All right. I got jokes. All I got is jokes.
Yeah,
All right. So what's the difference between acute pain and chronic pain? Because we hear a lot about that.
Yeah, that's a great question. So, by definition, acute pain is any pain that lasts less than 3 months. And so by default, chronic pain is anything greater than 3 months. And that's obviously a very arbitrary, almost an arbitrary type of diagnoses. But really the reality is we treat a whole spectrum of acute and chronic pain as well. But as it pertains to pain management, we do the most interventional and most advanced techniques available. Not only regional anesthesia for patients who are having perioperative care before surgery, but also patients who need care after surgery and patients who've had chronic pain for quite some time, secondary to different diagnoses that can occur as we age.
So why don't you give me some examples of some typical things that cause pain that you're dealing with on a daily basis?
Well, as an interventional pain management physician, I deal a lot as it pertains to patients that come in with spine-related injuries, spine pain, nerve root pain, sciatica, radiculopathy, disc herniations, chronic degeneration, patients who, even the weekend warriors, patients who are tennis players, basketball players, come in with back pains, aches, so on and so forth. There's a lot of stuff we can do for patients who have chronic abdominal pain. They've had surgeries, they've had multiple injuries in the past in their abdomen, and now they've got pain that nobody can really figure out why are they having it. We're able to diagnose through different procedures and treat so that we don't have to, and patients don't have to rely on chronic opiates.
Right.
And I think that's our goal, is to really improve the quality of life, decrease the opiates that are being consumed, and really make them, as you said, happier. They leave the office with at least hope. Right.
Well, so that's you bring up a good point there, because as we get older. Right, and I think that happens to just about all of us as we get older. We start to experience more and more pain, and I think we begin to accept more and more pain, if that makes sense.
Sure.
Which is, as I personally am 42 years old now, and I feel like every day there's a tinge of a pain somewhere in a different spot on my body, and I'm just like, that's just I'm getting older, and I was never in great shape to begin with. At what point, how do you evaluate and kind of measure when pain is too much pain, if that makes sense?
Yeah, and that's a great question. The honest answer is that pain is subjective, right? In the sense that, what is excruciating pain intolerable to you may not be so for the next gentleman or lady. And it really depends on the patient. It depends on the patient, depends on pathology, what they're coming in with. If somebody has, a big disc herniation causing compression in their neck, making their entire arm numb, and they can't sleep, they can't even breathe without having pain, I think that's something that we need to address.
Right, yeah, that'd be bad. That
would be bad, But patients with chronic knee arthritis pain that just does not get better with conservative treatment therapies, anti-inflammatories, non-narcotic neuropathic pain medications, nerve pain medicines. At that point, we say, well, listen, we can help with interventions that can improve the quality of life, and I think that's really what it's about. The reality is, once you get to a chronic pain level, and like you said, I think it'd be unrealistic, I should say, to say I'm going to have zero pain. But if we can improve the quality of life and really improve your activities of daily living, I think that's our goal.
Right. But it is fair to say that probably as we get older and older, we live with some degree of discomfort.
Yeah, absolutely. And we're not talking about the general aches and pains.
Right.
The weekend warrior that goes out and plays an hour and a half of basketball, not having done anything for 3 months, 4 months, on a Saturday, and wakes up with sore calves and quads and so forth. And that's different. That's expected. And you're right. Even those who aren't necessarily playing sports or anything like that, yeah, absolutely, we can have just generalized aches and pains, and that's different.
Yeah, I find myself. This is really sad. Monday morning, I woke up and my ankle was bothering me. Right, and I was like, "What did I do?" And then I realized, yes, this weekend I watched 4 soccer games from the sidelines. I coached one of them, and yeah, I stand up because they're my kids, and I'm pacing the sidelines, and but like I actually felt like sore from that's really bad, right? I mean, that's a whole different level, right?
I don't know about that, but I think it's listen. Like I
could
said,
it be mental, doc? Help me out, come on.
not a psychiatrist, but I'm sure some of it is somatic. Some of it's coming from your ankle itself.
It is psychosomatic, isn't it? Thanks, I appreciate it. Thanks. All right, let's talk about treatment options because we hear a lot about, and you mentioned it already. We hear a lot about using drugs to treat pain. So, what kind of treatment options are there?
So, that's such a complex question. Really, as it pertains to interventional pain management, there are treatment options available now that people not even, to be honest with you, heard of. Generally we saw pain management. You get 3 epidurals and that's it. You're done. And the reality is, yes, that's a part of our practice, but a very small part of our practice. The reality is, patients from top of their head down to their feet. There's stuff that we can do. There's intervention that we can do, and it's not just about injections and so forth. But we also definitely recommend staying active, therapy, like I mentioned, non-narcotic medications, nerve pain medicines. It's important to really treat the patient as a whole, and that also includes occupational therapy, and really understanding, having a positive outlook, and understanding that yes, we can help, but there may not be a fix.
Right.
So when it pertains to interventions, going from the head down, even patients who have trigeminal neuralgia. We have procedures that we can do to help decrease that. We have medication that we can write that are prescribed that are non-narcotic that can help that. Patients will have RSD, CRPS, reflex sympathetic dystrophy, complex regional pain syndrome, into the face, into the arms, even into the abdomen. There are procedures that we can do under X-ray guidance that very precisely target the nerves and help really calm down that area that's painful. We do procedures called spinal cord stimulation, which can help decrease pain by methods of modulating the nerve transmission signals as it goes from the spine back up to the brain. Patients who have chronic degeneration of their back, arthritis of the back. Patients wake up, doc, my back's aching in the morning. Or when I'm playing tennis, when I'm golfing, when I'm swinging the golf club, my back's aching all the time. That's not a sciatica; it's just aching pain. You go to your doctor and say, "Oh, it's arthritis."
Right.
Well, there's stuff that we can do. There's procedures we can do to help get rid of pain.
So when we come back, I want to talk about that for a second because I think that I don't know how much you deal with this, but I know that for a lot of folks, it's just a matter of stretching more regularly or doing some very basic exercises. I'm sure that must be frustrating to you because I'm going to go out on a limb and say the majority of folks don't pay any attention to that whatsoever. When we come back, Dr. Vic Singh, pain management specialist, Ocean Medical Center, back right after this.
Get more Wake Up with Jeremy Grunin at our website, WOBMAM.com. News Talk Radio, WOBM AM 1160 and 1310.
Cool. Welcome back. Wake Up with Jeremy Grunin. We are here with Dr. Vic Singh. He is a pain management specialist at Ocean Medical Center. And I was just sampling some things in the break. And so if I talk a little slower here, I apologize. No, I'm just joking. That doesn't happen like that. Okay, so we're talk about, like, you mentioned, actually, I think you mentioned occupational therapy a little bit, but physical therapy. So how often are you talking to patients about that, about the fact that, if they're having a recurring pain or a chronic pain in a certain area of their body, that there are things that they can do just through normal exercise that can help kind of mitigate that pain? And then how often are they paying attention?
I hope they're paying attention all the time, because
Right.
I preach that at every visit, almost every visit that I see our patients, that listen, one thing is to help. We can help decrease, my colleagues and I can help decrease the pain, but the reality is you have to get everything stronger. You have to get everything more mobile. You have to get more active, and definitely we are very big proponents of doing, like you said, physical therapy, occupational therapy, and really getting out there. Now, obviously, you don't want to injure yourself,
Right.
So we recommend that you do it under the guide of a professional. And so most of the time, patients they listen. They
Right.
want to get better. But sometimes it is a struggle. You're right. Patients, doc, can you just do something to help me get rid of the pain? Yes, I can, but you got to help yourself
Right.
too.
Everybody wants the quick fix, though. Everybody's like, "Can you just give me something that I won't have to have this pain anymore?" So I mean, like, for me, I know I have plantar fasciitis, and my doctor always tells me you need to, whenever you're sitting, you just need to push your foot up against the desk and do this thing for 10 minutes a day. And I'm like, I know I'm supposed to do that.
Yeah.
But that never works out for me. So instead we just, we're orthotics and hope it all works out. So how do you help patients manage pain specifically after surgery? Because that's, shock to the system, completely different way of dealing with something. What do you do?
Sure. It's interesting because post-operative pain management begins with preoperative assessment and not only medications but also interventions that our anesthesiologists do at Ocean Medical Center that can help. A lot of that is also related to regional anesthesia. Now, what do I mean by that? So if a patient, for example, is having knee surgery, we can do blocks and we can put catheters into different nerves of the body that can help decrease pain not only during the case but also after the case, so that they're able to get more mobile and so they're able to improve their function much more quickly and really be able to leave the hospital and get onto therapy much quicker. And obviously pain control is a big issue, and if your pain's not well controlled, you're not going to be able to be more active. You're not going to be able to get better sooner. And then what ends up happening is patients get significantly sicker as time goes on, because now they're bedbound. Now they can get pneumonias, they can
Right.
get ulcers, and all sorts of other not nice things. So we really want to take care of them preoperatively with regional anesthesia. It's not just for orthopedic surgery, but patients who are having chest wall surgery, patients having abdominal surgeries, shoulder surgeries, elbow surgeries, you name it. Our physicians at Ocean Medical Center, our anesthesiologists, are experts in regional anesthesia, and also not only narcotic management, but also non-narcotic medication management. And that's been shown significantly that a cocktail of non-narcotic medications, in addition to opiates when needed during and after the surgery, has really helped to decrease patient pain.
Cool. So when we come back with Dr. Vic Singh, so one of the things we're going to do is we give you a magic wand and we say, listen, you have an opportunity to make a difference, make a change, do something special in the world or in your area of expertise. What are you going to do? But I also want to ask you a little bit about special considerations when you're doing pain management for older adults and things like that. So Dr. Vic Singh, Ocean Medical Center, talking pain management. Very interesting. Stay tuned. Wake Up with Jeremy Grunin. We'll be back right after the news.
The news is next. Live from the WOBM Newsroom, the Town Square, New Jersey News Network, and Fox News Radio. Wake Up with Jeremy Grunin. News Talk Radio WOBM AM 1160 and 1310. Live from the Bob Levy Broadcast Center, overlooking the Toms River. It's time to get up, get out, do something. Wake Up with Jeremy Grunin. Be a part of the show. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Hey, welcome back. Wake Up with Jeremy Grunin. 7:34, Wednesday, May 25th. 56 degrees, getting up to 86 today. That 56 number, that was my number like 2 hours ago. I'm sure it's gone up. Let's say it's higher than 56 degrees right now, but it's going to be beautiful today. WOBM AM 1160 and 1310 News Talk Radio. Streaming live on the Radio Pup app and WOBMAM.com. 732-505-1160 to join the conversation. We are talking to Dr. Vic Singh, pain management specialist, Ocean Medical Center. So, Doc, any special considerations when you're doing pain management for older adults? We have obviously a very large senior population here in Ocean County. So what do you have to take into consideration there?
Yeah, that's a great question. As we age, a lot of our body systems start slowing down, and really the old adage is, start low and go slow. And that's for everything. In terms of medications, in terms of the anesthetic, in terms of the local that's being infused in for any sort of surgeries prior to in the perioperative setting. And you always want to monitor, right? I mean, the key is communication with the patient. You're giving a dose, even if it's the starting dose and it's in the lowest possible. Communicate, talk, listen to the patient. Doc, this is making me feel a bit strange, or I'm getting weird side effects, or whatever it may be. I think the important thing is to communicate with your physician. Now, pain management, not only pain management, but your internist and whoever you're seeing. And I think that's the goal, because without feedback, the physician will assume that you're doing reasonably well with it. And that being said, you got to always make sure that lines of communication are open between both parties.
Right. And I know it's very subjective, and we were talking about this, but how would you advise someone when is the right time to actually consult a pain management specialist?
I think as a pain management specialist, I think any time is the right time, and the reason being, unless it's something that's acute that needs immediate surgical correction, or obviously if you've got a cold or cough, or you should see the appropriate internist or whatever it may be. But at any point, if a pain or discomfort is just not getting better, or there's a weakness that's starting to come up into an extremity or whatever it may be, it's not unreasonable to talk to your internist and see if you need a referral to a pain management specialist.
Right. And so, the last thing, and then, the last thing, we talked, you hear a lot in the news, and we talked, I know we talked about on this show probably about a month or 2 months ago, and I was kind of talking to you about it in the break, that one of the emergency rooms up in Patterson is saying that they're eliminating opioids, right, altogether. They're not they're gonna avoid it altogether. So, and I know there's a horrible fear of folks becoming addicted to to pain medications. What would you say to that? How would you advise on that? What do you think?
Well, I think that opiates are not the first line treatment. So in that sense, I agree with what the ER is saying, in that we will try everything that we can with non-narcotic medications, and that's appropriate. I think that's the right way to go. Advil, Tylenol, obviously the more obvious answer over the counter. Taken within reason can be profoundly effective when it comes to pain. But then, as it pertains to advancing the opiate treatments, obviously, talk to your physician, talk to your specialist in regards to that. But I think that measured steps must be taken to help curb the overconsumption and overutilization of opiates and its subsequent side effects and issues that have been having in society.
Right. Yeah, and so it's like anything else. I mean, everything in moderation. Unfortunately, I think folks get hooked on things too easily in our society. Whether it's a drug, whether it's gambling, whether it's there's so many things, but we could spend a whole different segment on that. But we're not going to. Instead, we're going to give you your magic wand, your pixie dust, your fairy dust, your ability to just wiggle your nose and make something happen. My first thought would be that you would say to eliminate all pain, but then you would be out of a job. So I don't know if that's exactly.
I would be okay with that, to be honest.
Yeah, you would. But then what would you do? I mean, what was the fallback?
I'd find something.
Yeah. All right. So what would you do? What would you do if I give you the magic wand?
I don't know about eliminating pain is I think too broad. I don't know if that counts with the magic wand. But I think having taken care of patients that have cancer, I think to me that would be the most profound thing that I could, my magic, wish would be if we can find a cure for cancer, really, I think that would be amazing. Yeah,
listen, I agree with you. It's, we do a lot of work with the American Cancer Society, and every time I go to one of their events where you have 300 people in a room, at a gala, and invariably, one of the most impactful moments is when the person at the front of the room, whoever's emceeing or presenting, says, "Can everyone in this room who's either personally been impacted by cancer or who's had a loved one impacted, please stand up." And of course, there is no one in the room who's sitting in their seat at that point, because everybody has either been personally impacted or had someone super close to them who's been impacted, and it really is unbelievable. So I agree with you 100%, and I'm sure with what you do, It's just about mitigating as best you can and trying to, help people cope as best they can. But what a horrible, horrible, horrible disease. Dr. Vic, thank you so much for spending some time with us this morning. I learned a lot about pain medication. I've learned that I need to man up a little bit and kind of deal a little bit better. Maybe I need to pay attention to my doctor and actually do some exercises for my plantar fasciitis. And I've also learned that if I were going to Ocean Medical Center, I would feel super comfortable that you guys would have it under control, and I would be in the best place that I could be with any surgery or any other pain that I was dealing with.
Super. Thanks so much for having me.
Thanks so much for coming in. Wake Up with Jeremy Grunin. We'll be back after this.
Stay tuned for Preferred Company with Joel Markell and Marianne Levy at 8. Wake Up with Jeremy Grunin continues next. News Talk Radio WOBM AM 1160 and 1310.